All right, there's my screen. Good morning, everyone. Happy Thursday. Happy holidays. Thank you so much for taking time out of what I'm sure is a busy week for you to join the Zero Suicide Learning Collaborative. Before I started the recording for the session, I was letting you know I'm not in my normal space. I'm in Wisconsin, home for the holidays. So if there's anything wonky with my internet or audio, please feel free to let me know. In the chat, if you would please let us know who's here with us today by dropping your name and your organization in for attendance. If you could also put in your facility name, if you're from a large system like UC Health or Centura, for example, please also put the actual facility you work at. And our little check-in question today is your response to what's one thing that you can do for yourself today? How are you going to show up for yourself? I know if you watch Parks and Rec, you're probably familiar with the phrase treat yourself. How are you going to treat yourself today? I know the holiday season, so easy to focus on others and the stresses with our job, but just want to see what you all do to be there for you. About all caps shopping, really. I feel that in these last couple days. Wake up early, have a cup of coffee, and watch the snowfall. Oof, sounds peaceful. More coffee, staying warm. Yeah, I hope everybody's staying warm. I know the cold is quite vicious. I'm gonna share out some resources for warming centers across Denver and Boulder areas after the session today. Thank you so much for joining us. Again, this is the Zero Suicide Colorado Learning Collaborative. We're gonna get started in just a couple minutes. If you're trickling in, please put your name, your organization into the chat for attendance. If you're from a large system, please include whatever facility you work at. And then your answer to this question, what's one thing you can do to treat yourself today? Or how do you like to show up for yourself when times are stressful or busy? Laura, are you going to Snoop Dogg? Exciting. And I hope if you have holiday travel plans that those are going smoothly. I know a lot's been tossed up in the air in the last couple of days, so my fingers are crossed for y'all. Awesome, we'll give it just one more minute for people to come in. Not a packed agenda today other than our wonderful speakers, who I'm super excited to hear from. We'll be chatting about professional well-being and how to transform self-care initiatives to be a little more holistic in healthcare settings. I'm gonna toss it over to them in just a second, but thank you again for joining today. If you are just joining, please don't forget to put your name and chat into the attendance. I sound like a broken record. I'm gonna put it in the chat again too, but we really wanna know who's here today so we can give you credit for being here if you need it. And so we have a good sense of where Zero Suicide is happening across the state. So love all these responses, how people are checking in with themselves and showing up today. Thank you for adding those. Take all we can get at this point, right? All right, I think we are at about 5 minutes in. So I'm going to toss it over to Erica and Jen to introduce themselves and chat about self-care and health settings. I am super excited for this presentation. Heard from these folks at the National Association for Rural Mental Health Conference recently in a breakout session, and thought this would be a great thing to add to the Zero Suicide space. So yeah, without further ado, thank you so much for being here and looking forward to your chat.
Wonderful, thanks. Thank you, Conlon. I am going to share my screen here, and I told both Jen and Conlon to just let me know if I start getting a little choppy. I'll turn my video off. So please don't hesitate to unmute or holler at me in the chat. I'm going to make sure that I can see the chat here. Can you all see the slide? Okay. Okay, perfect. Wonderful. Well, welcome. We are so glad that you are all here, and on a day that is leading up to a holiday weekend. Thank you so much for carving some time out of your day to spend with us today. My name is Erica Franta. I am the School Mental Health Program Director at the Mid-America Mental Health Technology Transfer Center. And we'll explain a little bit more of what that is here in a little bit. And I'm going to toss it over to Jen to introduce herself. You're going to hear from both of us today.
Hey, good morning, everybody. I am so happy to see so many people this close to Christmas showing up for such an important session. My name is Genevieve Berry, or Jen, and I am the program manager for the Mountain Plains Mental Health Technology Transfer Center, which actually serves the states of Colorado, Wyoming, Utah, Montana, North Dakota, and South Dakota. So happy to see some of my Colorado folks here.
Wonderful. And as Conlon mentioned, we are going to be talking with you all today about professional well-being and how we can transform self-care initiatives. I'm going to do my best to do justice to the presentation that Conlon got to hear from Dr. Clark. She is our project director and a mentor to me. So hope that it lives up to all the hype. But we're going to be doing a two-part series with you all. So today, Genevieve and I just kind of thought, today might be a tough day to really do a lot of maybe like problem solving or planning or talking through like more complicated, nuanced topics. So we wanted to give you some time today to just sit back and hear a little bit about what our network does, what like kind of identifying and discussing the importance of professional well-being. We're going to outline a resource for you, and then we're going to jump into a specific practice. But then in session 2, we're really going to dive a little bit deep into how it is that we can, as organizations, as healthcare professionals, as mental health clinicians, how we can help to support some organizational change in really rolling out holistic well-being initiatives, if that kind of makes sense. So hopefully today it's a little bit more relaxing for you all to just listen in, and then we're going to do some awesome mindfulness practice with Genevieve as well. We are a federally funded agency, and so we just need to provide with you a disclaimer that this presentation was prepared as part of the network under a cooperative agreement with SAMHSA, and that these views are of Genevieve and myself. We do not speak for SAMHSA, DHHS, or anyone else. We also like to highlight that as a network, we really aim to use affirming, respectful, and recovery-oriented language in all of our activities. We hope that as we talk about professional well-being with you today, as we talk about using skills to support our own mental wellness, that we're using strengths-based and hopeful language, that we're inclusive, healing-centered, and person-first. We also ask that you call us in if you feel like we are not doing that, and we're always open to making changes and growing in order to be as inclusive and recovery oriented as possible. Also, just want you to know that because we're a federally funded agency, we do ask for some input at the end of our presentations. Part of that is to show that to SAMHSA that we are indeed doing what it is we're telling them we're doing, that we're using our funding for. But the other part of that is that we get some useful feedback from you. And we really do use feedback from our audience, from our trainees, every time that we work and do a presentation on well-being or any presentation. And so we really just appreciate that feedback, and I will share a link and a QR code to that at the end. So a little bit about our network. The MHTTC, or Mental Health Technology Transfer Center network, was established by SAMHSA in 2018. We are a network of 10 regional centers and 2 national centers. So we have a national center, the National Hispanic and Latino Center out of Puerto Rico, and the National American Indian and Alaska Native Center, which is out of the University of Iowa. And then we also have a network coordinating office that's stationed out of Stanford. So we are, myself, me at Mid-America, I am Region 7, and I serve Iowa, Kansas, Nebraska, and Missouri, just that 4-state region there in the middle, the yellow. And then Genevieve serves Region 8, which is the Mountain Plains MHTTC, and that is those light blue states next to the yellow states. I don't know if y'all can see my pointer. And so we were established simply to transfer technology, which really is share evidence-based practices with the mental health workforce. So we really were funded by SAMHSA to be providing support, free training and technical assistance to the workforce around evidence-based mental health practices. And each of our centers really has identified our own kind of area of expertise. And so you'll learn maybe a little bit about that from Genevieve and myself as well. The great thing is that we partner a lot with Genevieve's center because we cover a lot of the rural states here in the United States. So we do a lot of partnering, especially around rural mental health, telehealth, those types of topics. So it's really exciting for us to get to be here together today. So the Mid-America MHTTC is housed out of the Monroe Meyer Institute at the University of Nebraska Medical Center. Again, we serve Iowa, Kansas, Nebraska, Missouri, and our project director is Brandy Clark. And then Mountain Plains MHTTC is a partnership between the University of North Dakota and the Western Interstate Commission for Higher Education, or WICHE. They serve Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. And they have co-project directors being at two different universities. So Rachel Navarro and Dennis Mohat. Both are wonderful, and so wonderful to get to work with Genevieve as well. So I'm Erica Franta. I'm the program director, the school mental health program director at the Mid-America MHTTC. So each of our centers actually does receive supplemental funding to be supporting school mental health. And a lot of our professional well-being work at Mid-America started in the realm of education, and then we adapted it to work a little bit, adapted a little bit differently to be more integrative into our healthcare systems as well. I'm an assistant professor at the Monroe Meyer Institute out of Omaha, but I actually live in St. Louis, Missouri, and I'm a licensed psychologist trained in school psychology. So I serve kids and families birth to 21. And Jenna, I don't know if you want to jump on and introduce yourself, or if you want me to do that for you either is great. Oh, wonderful, Danny, that's great. So Genevieve is the program manager at the Mountain Plains MHTTC. She has her BA in psychology and engages in trauma-informed coaching and somatic yoga. And so that's why she's going to be leading us through some somatic mindfulness activity. Oh, sorry.
Oh, no, you're perfect. I couldn't get unmuted. We were just talking to you all before we started doing all this Zoom training. And then I'm like, why won't it unmute? Yes, thank you, Erica. That was perfect. And the only thing I would add is that for the Mountain Plains MHTTC, our focus area is rural mental health. And so with you all being located in many rural communities, you know that takes a little bit of a different flavor than a lot of the mental health programs and workforce development that happens in more urban settings. So, but great job. Thank you.
Thank you, Genevieve. No, that's wonderful. I love that. And that's really where we've partnered, I think, with Region 8 a lot, is around our rural mental health initiatives. We at Mid-America, our primary areas are integrated primary care, mental health workforce development, serious mental illness, and school mental health. And of course, being in, especially in the middle of the United States, many of our communities are rural as well. And so Genevieve's team has been just so helpful and useful as collaborators and partners to help us support our rural communities too. So today, what we're going to do is we already introduced the MHTTC network, and I'm going to try and keep an eye on time. I have 3 screens up, so please, Genevieve, feel free to share in the chat if you're like, if I need to pick things up a little bit. Sometimes I also talk too fast, so either way. We already introduced our MHTTC network, and I just want to reiterate that what we do is provide free training and technical assistance. So if there's anything that could be useful to you all, your organization, your center, your team around supporting professional well-being, please don't hesitate to reach out to Conlon. He can share our contact info. I think we have a slide with our contact info here as well, to reach out to us to see how we might be able to support you, because it is federally funded. So everything that we do is free unless it involves food, which we can't cover. Then I'm going to review the importance of professional well-being. And I think much of this will probably be information that y'all already know or have heard, but I just like to, whenever I do this presentation, I always like to remind people that we have to all agree upon our why before we can start talking about what it is we're going to do about it. So even though much of these data, these frameworks are not going to be new to any of you all, I just like to make sure that we have all come to the same, we're all here in the same space with the same understanding of why something is important or how or why it is that we need to address it. And then I'm going to very briefly outline one resource that we have at Mid-America, which is called the Adult Resilience Curriculum. Oh, sorry. Sorry, did someone jump in? Oh, okay. I'm going to outline one resource called the Adult Resilience Curriculum, and we're going to expand on that in session 2, as well as talk more about organizational level well-being within the Adult Resilience Curriculum framework. And then I'm going to toss it over to Genevieve, and we're going to do a practice of somatic mindfulness, which hopefully I know I'm super looking forward to after the week that this has been for me. So I hope that you all enjoy it and we can really kick off our holiday time in a calm space. So I totally appreciate that. Now I know where people are coming from, their organizations, their names. Love it. Thank you all so much. I would also love to know what your roles are. Are you a clinician? Are you in education? Are you an administrator? Anything that I'm missing? This is not obviously an exhaustive list. So just as I'm going through, as I'm getting started, I would just love to know who it is that we're all talking to today. Process improvement specialist. I love that. What a unique title. Manager of social work, RN, wonderful. Thank you so much. So a mixture, it sounds like maybe of some clinicians as well as some directors, administrators. Awesome. I really appreciate you all sharing. Thank you so much. So I always like to start this, and I know this metaphor maybe is getting old for everyone, but I still love it no matter what. And I think about it every time I get on a plane, which has happened more lately than it has, unfortunately, in the last 3 years. But whenever we get on a plane, flight teams are really required to share with us safety instructions. And these safety instructions honestly have, remained the same for a very, very long time with maybe some slight adjustments over the years. But one of the most important things that they tell you is how to manage the oxygen masks in an emergency. And what I noticed now, having 2 kids of my own and flying with them for the first time, is that I've now experienced this, that when you have children with you, the flight attendant comes up to you specifically and says, you remember, if something were to happen and we need oxygen, you need to put on your mask first, and then you can worry about your kids' masks. And obviously, this is not just specific to children, it's specific to, they say it to everyone on the plane as well, right? That if someone else were to need our help, we need to make sure that we are putting on our oxygen mask first. And we use this framework to really be thinking about professional well-being, why it matters and why it is important. Because if we don't have our oxygen mask on, we can't be supporting our patients. And so the best way really for us to be supporting our patients is for us to be supporting the professionals that work with them. So part of that, right, is learning how to support ourselves. But we can't just put that pressure on each of us as individuals. What we know is that our systems have been set up in such a way that many of us are struggling. And so while absolutely we can take some accountability, some initiative to address our own well-being independently, and we're going to talk about some skills to do that today, the bigger picture, the more long-term solution is really for us to be assessing our systems and how it is that at an organizational level, at a leadership level, we are actually creating space for people to, one, support themselves, but also creating space for us as an organization to be supporting our professionals. And so that piece, that organizational piece, we're going to talk about in March. But we're going to kind of get you all oriented to our sort of theoretical framework to why that matters and how we approach organizational well-being as well. So while we're sharing in the chat, would love to know, how are you all feeling today? This time of year for myself, a little disclosure, is always super exciting and super disappointing. It feels like with young kids, we tend to make it to about now, and Genevieve knows I've been home with very sick children for the past 10 days or so. And so all the fun things we wanted to do, we didn't get to do, but we're making our own fun. But I feel like this is the time of year that I just feel kind of like in between these two these two emotions of super positive and sometimes a little bit negative at the same time. So I love that. Cold but great, exhausted, yes, festive, pressured, tired, safe and sad, good, ready for a break, rushed. I feel like especially this time of year, this image right here of this person with Post-it notes all over their face and body and all over the wall can sometimes capture many of us. And many of us also feel chill and excited and happy and grateful and good. And thank you all so much for sharing that with us. That's really why Genevieve and I wanted to take this time today to really just do some outline. Like I said, sit back and listen a little bit, but please don't hesitate to shoot questions in the chat or unmute and ask me questions. And then Genevieve is going to end today with hopefully getting us in a nice space to finish out the day and the weekend. So I always want to start with the what. So what is well-being? What we know is well-being is sort of like it's kind of a trend word these days, self-care, well-being, very trendy. So I want us all to be agreeing upon the same definition. But first, while we're getting started with well-being, what does well-being kind of mean to you? Give me a word, 2 words. How is it that your team, how do you, either professionally or personally, how do you define well-being? In balance. Oh, I love that. Balanced, leveled, rested. Absolutely. At peace. These are great. I'm going to have to save these definitions. Being honest with every part of my body and mind, content and grateful, living in a power of wellness. Wonderful. Grounded and productive. Absolutely. So you all are really in alignment with how we as a team think about well-being too, as this holistic approach to balance, comfort, connection, being grounded as well. And I really like to define this because this term self-care has really kind of taken off. You know, it's a hashtag, it's all of these things. And while self-care, absolutely, like there's no argument as to whether or not, right, self-care is important. I think that what we've noticed in working with professionals since COVID really around well-being is that there's really been this focus currently on self-care being this immediate fix, this go and get your Starbucks and feel better. And what we really want to be thinking about is this idea that true self-care is more than just that, right? That haphazard, unplanned, sporadic, immediate short-term action. But really what it is this longer personal endeavor over a lifetime. And it can't really be distilled down to these right set of practices. I'm going to talk with you about a resource, but what I know is that this well-being is not a one-size-fits-all type of scenario, right? And there isn't a program or a curriculum or anything that truly is the right thing for everyone. And so we want to keep that in mind. Oh, sorry, I can't see everybody's faces. I'm sorry. Right set of practice. So we really take this SAMHSA kind of approach of the 8 dimensions of wellness, and that's really how we are thinking about well-being as well as a holistic integration of our physical, mental, and spiritual well-being. And so when we talk about supporting our well-being, we're talking about strategies that help us in all of these domains. But we also recognize that we can't have true well-being, right, in all domains at all times. So what we know is there's always going to kind of be this tug and, this release and pull of each of our domains in order to really be feeling that balanced, grounded, relaxed, centered self. So we do also talk about, so within the title, right, of ARC is resilience. So we talk about subjective well-being really as being the perception of how good one's life is overall. But resilience is really that capacity to bounce back. And so when we talk about well-being, we're really talking about how is it that we are all perceiving our life satisfaction, in combination with our affect. But then resilience is how it is that we might bounce back from ups and downs. And I know often there has been a lot of focus on resilience, especially in the professional well-being world, in the literature, and that can often feel like that we just expect people to bounce back, or that it's only on you to be able to bounce back. And so I'll talk a little bit more about how that's not really our approach to resilience at all. So why is it really that well-being matters? Throw in a word or two why it is that you feel like your well-being matters. Either in your personal life or your professional life, it doesn't matter, or in your life overall. Because you matter. Absolutely, Deanne. I love that. To be effective, show up, stability, stay healthy, you're nicer. Yes, it impacts others. You're there for yourself and others. Absolutely. And so what we know and what you're really alluding to here is that if we're overly stressed as providers, if we're overly stressed as administrators, and we can't provide adequate evidence-based care to our patients, we cannot adequately, in an evidence-based way, support our teams either. We also know that well-being, professional well-being is really, it's a public health crisis. Stress and burnout are so common within the healthcare space and these reactive approaches that we've taken over the years have not helped that, right? We just keep becoming more stressed out and more burnt out, and we're really losing a lot of our workforce. We also know, or at least we believe, my team as psychologists, as mental health professionals, that we really do have an ethical responsibility to promote healthy workplaces and healthcare environments. Of course, as we've already established, our well-being impacts patient care, which at the end of the day, right, is usually the top priority of many of our organizations, is quality patient care. But we also know that there's a lot of data to say that healthcare professionals are a critical factor in even creating these healthy systems to begin with. So when we talk about organizational well-being, if we are not well, how can we even create change in our systems to be able to support everybody's wellness and well-being? We also know that, honestly, burnout and stress costs a lot of money. There is a high return on investment when we do invest in setting up systems and supporting our workers in their well-being. And there's just a lot of research to say that programs that enhance wellness and well-being do indeed reduce stress and do indeed improve the well-being and effectiveness of our workforce. Oops. I'm going to skip over this one a little bit. I feel like I get too negative. Sometimes this section starts feeling too negative, but there's a lot of stress that we're experiencing across the board, right? Not just this holiday time, but in general, when we see our workforce is declining, when we see that we're all feeling a little bit burnt out, we're all feeling a little bit stressed, our scales are tipped. We have potentially, hopefully, right, some of us are potentially already making some efforts to improve well-being within our organizations, within our clinics, within our teams, but all of the stressors have just kept adding up. And so it's been really hard for us to kind of balance that out. And we've seen that across our region. We've seen that not even just within my region. We've done a lot of this work out in Colorado as well, Idaho, Utah, with teams. And I think across the board, we're seeing this in both healthcare and educational sectors, especially since COVID and the kind of like mistrust that many people have with professionals in our field at this time. It's just continuing to build up the stressors and increasing our burnout across the board. So when we talk about stress, burnout, what we're really concerned with, especially with healthcare professionals, is that many healthcare professionals are experiencing vicarious trauma through their interactions with families, with patients. And this is really a cognitive change process that happens in our brains, resulting from this chronic direct interaction with trauma, with populations who are experiencing trauma. We also know many of us are indeed experiencing burnout, emotional exhaustion, depersonalization, and reduction in this like sense of our own personal efficacy, accomplishment because of our occupational the occupational hazards really that come with doing our job. And then ongoing, we're experiencing compassion fatigue in general, which is really just this physical as well as emotional exhaustion that makes it challenging for us to really feel empathy and be compassionate to others because we're doing it so much. And what do we know kind of statistically about burnout in this population is that healthcare workers report on average of 50 to 60-hour work weeks, which is a lot. They also report roughly 25% greater frequency and intensity of burnout than other workforces. And when we're feeling burnt out, what we see is a reduction in client care and satisfaction surveys, staff turnover, impaired professionalism, depression, anxiety, suicidal ideation, and suicide attempts increase in this population. We also then see that often racial bias emerges. So when we are feeling burnt out, that we may, that our own biases kind of emerge, and that really impacts, right, our way to be inclusive and equitable clinicians, and our productivity is impaired. So when we're wanting to feel effective and efficient, it's hard to do that when we're burnt out because we are truly not operating at our highest standard. And I like to also, I talk about this a lot as a psychologist, is that I think sometimes when we talk about well-being too, we think that we all need to be operating at 100% all the time. Well, we're all complex, whole individuals. And many of us, I don't show up to my job and am always operating at 100%. And we've all started doing some check-ins just within our teams of, okay, what percent are you at today? Where are you at? And one of my colleagues said one day, she said, I'm operating at about a 70%, but that's like the best that my job gets, because there's always this 30% that's doing something else, right? That's focusing on something else. And that's okay, right? Not all of us operate at 100% in our professional work life. So I think that's a nice way to rethink about when we're supporting our well-being, to not be discouraged that this means that we're trying to always operate at 100%, but that we're trying to get to, the best capacity that we have in that day. So how is it that we can actually support well-being? Well, as I said already, there is no such thing as a one-size-fits-all approach to well-being. There are many programs, many frameworks out there to help support well-being. Actually, just within the MHTTC network, I know of at least 4 different programs, specific programs or models or interventions that people within our network have used to help to promote professional well-being. So as we're overviewing the adult resilience curriculum and the organizational well-being tool and those types of things, if those don't feel like a good fit to you, that is totally okay. And please feel free to reach out because I'm definitely familiar with other things that other centers are doing that are free. But there are also other plethora of programs that are not just within the MHTTC network as well. But what we also know is that on top of all of this is that we have to be taking into consideration the socio-political context of our workforce, of our teams, of our organizations, so that we are truly thinking about how our structures, our systems, the systematic racism that does indeed permeate itself through our systems, how that is impacting our workforce as well. And so our approach to self-care really begins with, one, defining the process itself, which we've sort of worked on, right? Defining that process of well-being, how we get there. And then really focusing on those ongoing efforts to maintain well-being. So really, we're looking at a holistic integration of those 8 domains of well-being and engaging in practices and creating plans, if you're a plans type of person, if that feels motivating to you, but doing some actual intentional planning around how it is that we are supporting the 8 domains of ourselves in order to enhance our well-being. And so what we need to be talking about, what we've been talking about with organizations within our team about these long-term strategies of self-care. We need a long-term strategy that is useful, but that's also flexible to what it is people are already experiencing, certain practices that are going to be helpful in the moment, but then also adaptation and taking those things and making them your own. And that's really what we have done with the adult resilience curriculum. It actually was a framework that was established, came out of a collaboration between the University of Washington, the University of Minnesota, and other community partnerships. I don't know if in the well-being world, especially in educational well-being, Dr. Cook is a large name. Many educators know. I don't know if that's the same in the healthcare setting, but Dr. Cook and Dr. Joseph are the two who really started the creation of this framework. And then a couple of their trainees actually came to Munro-Meyer Institute, which is where Mid-America MHTTC is housed, and were trainees for us. And they actually brought the program, and Clay thought, oh my gosh, what an amazing partnership. I've always wanted to make this freely available, develop the materials to make it freely available to anyone who would like to use it. So although it is called the Adult Resilience Curriculum, it really is more of a framework. It's not intended for you to go through each module or section one by one. It's really intended to be that adaptable type of program that people can make specific to themselves. And that's really what we liked about it. As a psychologist, I know that not all strategies work for all my patients. And I mainly work with kids and families, but I know that, right, we need to offer options and solutions. And we need to help with that process of identifying what works for us and what it is that we think we can use to support our individual well-being. But I also know that after working with many administrative and leadership teams, leaders also need that flexibility in deciding what is it exactly that their system needs to adapt, to change structures, to create space for well-being as well. And that's really the approach that we take to both the individual level as well as the organizational level in supporting well-being as a center. So ARC is really an integrative approach. It really takes the best practices from CBT, DBT, ACT, and positive psychology. And so many of you, as you've been in the mental health space, nothing in ARC, I feel like, will probably be new to you. Many of these are theories, strategies that we have all been talking about for many years. And essentially what the creators of ARC did was just took a look at the literature of like what are the most potent kind of variables within each of these frameworks, and how can we put those together into one package that then it's easier for us as individuals to identify some strategies that may work for us, to try out strategies, identify what might work for us, and create a personal plan of supporting our individual well-being. And then we've really added to that this organizational piece as well. So ARC really is, we have two versions, one for educators, one for health professionals. The skills and the content are not different across the two, the context is. But because the basis of most of the skills and strategies are based in adult psychology, adult positive psychology, it really cuts across all professionals. But we do know there are contextual variables, of course, that are different in education versus in healthcare. And so a lot of the organizational conversations, the strategic planning, especially with our leadership teams, tends to be the main component that differs across the two. Just kind of highlighting that in case you go to look at some of these resources and you're like trying to figure out what the difference potentially is. I know often, healthcare organizations are also supporting the schools within their communities, and we've found a lot of utility in using a similar framework, this framework really with those types of organizations who are both trying to support their professionals who are serving within the healthcare sector and also in the school-based sector. And so that's just something I know that we have also worked through, and how we adapt to those two systems too can be useful in reducing our own stress and burnout. So what we have within ARC is it's a 10 module, like I said, program. What we really hope is that many people focus on those purple modules, which are the core modules. What we found is those skills of engaging in and promoting context, as well as establishing our values, engaging in mindfulness practices, and connecting meaningfully with others are really the core to then move into coping, making changes to our health routines, as well as, in really thinking through and creating a more positive mindset. but that does not mean, oh, sorry, I just saw the comment. It's back. Can you all hear me now?
Yes.
Okay. And we have a bunch of free resources for you all to access. I just wanted to put this here so that I know that you all have the slides, then you can access our website specifically if you'd like to look through those. But again, we are going to jump more into this in March. When the components of the adult resilience curriculum were developed, what they found was an increase in self-efficacy, job satisfaction, well-being, hours of sleep, intentions to implement their own well-being practices, as well as the implementation in evidence-based practices. And this was mainly with pre-service educators. We are working on kind of compiling some data specifically from the teams that we have you kind of created trainers within teams of healthcare professionals as well, so that we can start kind of sharing some data and how this is truly working in the healthcare sector. But the initial preliminary evidence in support for this program came from education specifically. And what's involved in the framework is really these active ingredients, is what we like to call them. So we want a trainer who can establish a strong alliance. So a leader within an organization who can establish a strong alliance with the teams, the workforce within that organization. And then we really, what we try to include as much as we can based on, I think every team that I've worked with, we've established a different plan of like how they're actually using any of these materials, any of these resources. So what we try to do is do a little bit of learning, a little bit of in vivo practice, and a lot of independent practice and action planning. And that's why we're going to be doing some in vivo practice with Genevieve here in just a couple minutes. And then my favorite part, and what tends to be the piece that brings it all together within the adult resilience curriculum, within focusing on our own individual well-being, is this wellness plan. So module 10 can really be kind of used alongside any of the individual modules. And what it does is it really just gives people an opportunity to be reflective in the practices that they've learned. And really be thinking about, is this a practice that I would like to continue? Is this a practice, that's one of my top 5 practices, 3 practices, 1 practice that really I know works for me? Or is this something I just want to like kind of put to the side and maybe come back to later to see if this is a practice that will actually enhance my well-being? And so part of this, and what we have really worked with teams on, is it's not just exposing people to practices and exposing people to things that might be useful, but it's really also creating a plan around how it is that they're going to use that and being reflective in those practices. So with that, if there are any questions about organizational well-being, about the ARC framework, about resources that I might be able to connect you with related to professional well-being, please feel free to either unmute and ask or share in the chat, and I can address questions in the chat. Otherwise, I'm going to kick it over to Genevieve to start us on a somatic mindfulness exercise.
Great. Thank you, Erica. Do you mind doing the slides? Because
Yep,
you've got
that's
the share
perfect.
screen up. Great. Great.
Sorry, Lisa, which link are you? Oh, to the, yep. Yeah, I can do that.
I was going to say, sorry.
Take a few minutes. No, we can wait a few minutes. We have time. So
Yeah,
I was just going to say, if you could speak to what can be accessed by teams on their own and like what's readily available with any of these modules online, that would be awesome. Just where to direct folks.
Yeah, and I can, if we have a couple minutes, Genevieve, I can share with people how to access it. Okay, hold on one second. Let me get the link first. And then I can show you all how to navigate our website. That sometimes can be easy and sometimes can be challenging. So let me make sure here. I'm gonna move my screen over if I can here. So here's the link. And really the MHTTC network has a lot of resources around well-being. And so please feel free to go to even just the main mhttcnetwork.org page. You can click on products and you can search through all of the center's products as well. But this is specifically the link to the adult resilience curriculum for health professionals. And I can show you a little bit. So what is accessible on our website is everything that I outlined in that PowerPoint. So in that slide. So what we have, are video modules and slide decks. If you're wanting to deliver this, use any of the materials, everything is available. I will also just say it's a lot. So we've put in a lot of slides, a lot of content that's probably more than you actually need. And we've done that intentionally because we don't want you to have to create anything extra. We want you to be able to adapt what it is that is there. So don't be overwhelmed by like a 60 slide deck. Like, if you're like, I don't have 60 minutes, I have 10, totally fine. We can take some of the content and adapt it. So just want you to know that we're also happy to help you figure out how to adapt it. Then we have a trainer manual that will be up here. We're finalizing it, last round of edits this week. So we're hoping to get that up in January. Activity handouts, resource lists. There's a podcast that we hosted last year called Burnout Busters. And then there's a 30-day mental health challenge calendar that you can print and use. Otherwise, it's also interactive. And we also have a workbook, that can be used. So I was going to show you. So this is what the website looks like. Something that's just a little bit kind of, I don't know, confusing, I guess. To be honest, for me, it's super confusing. So when you click on a module, the video pops up below, but to get access to the other materials, you have to click the green download button, and then you can download slides in PowerPoint and PDF form. You can download our digital workbook, which covers the core modules, so modules 0 through 5 and 10. And then this is the training and facilitation guide that's included. So we hope that you have the materials that you would need, but they are, they may be more than you need, which is totally okay. This is not a manualized intervention by any means. I know some people get a little bit caught, especially in education, we get a little caught up in this is a curriculum and it has to be delivered in this way. It does not have to be delivered in that way. You can shorten it and adapt it. And we actually hope that you do. And so that's what each module looks like. So then all of the activities are linked specifically in that module as well, which are also located in the activity workbook just for those first core modules. Is that helpful? Any other things you'd like for me to share?
That was super helpful for me personally, so thank you.
Yeah.
Another question in the chat is if you can train others in this module, and that was my next question too, is just your structure around training leaders in this and what your TA can look like moving forward.
Yeah. So we do offer training of trainers ourselves, but we also know that especially many mental health professionals, many healthcare workers, like you don't need us necessarily to train you in this content. So I think what we like to do is just kind of like leave that up to the trainers. If you feel like you would like to be trained in how to deliver this, then we can absolutely attempt to support you in that, in whatever that way looks like. And I say attempt in just the space that we're coming towards the end of our grant year. And so how much I can promise is different than usual. But we can also work with Genevieve and her team in supporting you. But then technical assistance for us really looks more so along the lines of, hey, Erica, I feel super comfortable in the content. What I would like some help in is like some strategic planning. Like if I have 4 sessions and 30 minutes each session, what maybe could be a good plan? And we would be more than happy to set up a meeting with you and provide technical assistance around that. And honestly, Genevieve and her team have been trained in this. They've done, I think, Genevieve, have you done 2 of our training of trainers? And so she and her team are like super useful to be able to help you with that type of technical assistance as well. That makes sense.
Right.
Yeah.
Yep.
All right. Good. Did I miss another?
No, I think that was it. I'll just offer my efforts to that pot too. If you're interested in adapting this curriculum and would like me to take a peek and see where it aligns with what other resources we have in Colorado too, happy to do that
Yep.
with your teams. But yeah, thank you so much for that info, Erica. It's super helpful.
Absolutely. And I feel like we say this all the time, but our biggest thing, and I love you that you use that term alignment, is that the biggest thing, especially around professional well-being, is that there is alignment. We don't want to slap something else on top of all of the things many people
Right,
are already doing.
right.
And so that is wonderful. That's perfect. Okay. Now let me see here if I can get to my slides. Let me get to your slides, Genevieve, and I'm
You're good. You're
Whoops.
good. We're good. We're
wonderful.
good. Listen, we are coming to the end of the hour. And so I don't want to take up a lot of time. I want to get you all to the exercise, but I want to talk just for a minute about somatic mindfulness because it's been so impactful in my own life. So the definition of somatic mindfulness is the ability to step back from what your nervous system is telling you. You step back, you observe it, and you feel every bit of it. And then from that place, you're able to consciously decide what you want to do instead of automatically falling into long-standing patterns and the behavior that they dictate. So this work allows you, by observing the self, it allows you to be present. So as caretakers, and we're all caretakers in one sense or another, or we wouldn't be in this profession. We are experiencing trauma, and we experience trauma primarily first in the body. If you want to go to the next slide, Erica, I'll show you guys this. This work is based on, maybe you guys have heard of Vanderpool and Peter Levine, but yeah, they are tremendous in terms of helping to deal with trauma. And please remember that trauma doesn't have to be some big, horrible event that happens to you. It is a very personal experience. A lot of it happens in childhood, and we store our trauma. Each individual stores their trauma in the body first. It's in the muscles, it's in the fascia. I'm going to say that wrong. and it stays there. And that has to be addressed. The sense of safety has to be addressed before we're able, kind of like Maslow's hierarchy of needs. You guys are, I'm sure, familiar with that in terms of how people progress. So one of the most interesting things I found from my own personal experience, because I tend to live a lot through my mind. Yes, The Body Keeps Score. It is absolutely, it's a wonderful book. But I, for years, tended to do all the affirmations and the mind positivity and all these things. And please remember that one of the reasons we wanted to bring this piece into this presentation is that while organizational well-being is extremely important and being able to create those spaces, you have to do it for yourself first. And the first place, honestly, that you do it for yourself is within your body. And that's why we went into somatic mindfulness. So if a person is living in their mind, it's because their body carries intense trauma and emotions that they haven't had a chance to process. And the mind just becomes a safer place than the body. Now, there's nothing wrong with that. It's a safety and coping mechanism, and we all have it in one way or another. But the way to be able to release the trauma from your body is to, want to go to the next slide, Erica? Thanks. Is to listen to your body and then begin to use gentle movements, breathing exercises, meditation, dance, yoga, that kind of thing. Okay, so to the next slide. Now we're going to start on this. The breath is, and it's really, really simple, and it's really quiet, and it's really gentle, but the breath is the easiest way to come back into the present. When you take a deep breath, your body cannot simultaneously practice deep breathing and hold trauma or hold stress. It just can't do it. If you've ever noticed when you're really stressed or you're really anxious or you're really tired and you try to take a deep breath and you really can't. So this is a real simple exercise. It doesn't require any kind of, if you've taken any yoga classes, you know, they have the nostril breathing, alternate nostril breathing, and you hold one finger over a nostril and breathe through. Doesn't require anything like that, but it's called box breathing or four square breathing. And we have just a few minutes, so I'm gonna take everybody through it, but you can practice this at any time on your own, out in public, while you're driving, in the middle of a snowstorm, which is where a lot of folks in Colorado are right now. So the first thing I'm going to ask you to do is take a cleansing breath. Let's take a deep breath in and release a deep breath out. And so we're going to just follow this diagram, and I'll walk you through it once and then we'll practice it once or twice. So we inhale, and we inhale to the count of 4. Just follow my voice. Inhaling, 1, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Empty and hold, 2, 3, 4. The exhale, lots of times people will say, no, I've got 3. I've got a 3 square breathing, not a 4. But in the exhale and the hold is where a lot of the release happens. So let's try it again. And if you want to close your eyes, let's get comfortable. Make sure your shoulders are down. Shake off anything, any tension, and let's begin. Inhale. Let's inhale to the count of 4. Inhaling, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. And one more time, inhaling, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4, and hold, 2, 3, 4. And take another deep breath and come back when you're ready. So again, there are a plethora of breathing exercises and different kinds of meditation, but honestly, this 4-step, the box breathing, if you can give yourself a few minutes and practice that, it will help to calm your nervous system down. And from a calm perspective, then you can respond rather than react. The Mountain Plains Mental Health Technology Transfer Center, we have a Mindful Monday. They're experiential practices to develop personal resilience. It's a micro training every other Monday for 30 minutes, and we explore different mindfulness exercises. And I have the website up there. It's free to join. We'll be starting again in January, so I'll let Conlon know when those start again. But 30 minutes for yourself, it's been extremely popular, and I think really, hopefully really helpful for people. Okay, great. I made it.
Wonderful. Thank you so much,
guys.
Genevieve. That's super useful. So these resources, yes, these will be shared, Hannah. I'm not sure if Laura was able to get you these Conlon before today. So, but we can send them to you again if needed as well. So next, we're going to talk next time in March when you see our team. I will not be here, unfortunately, but you'll see another team member of mine, Dr. Jordan Thayer. We'll talk about organizational well-being and how we can support at the organizational level as well. And if you can, please take our survey. I'm going to show the link in the chat, but also if you have a smartphone, you should be able to just take a picture of that QR code. Oh, good. Perfect. Thanks, Laura. Laura shared it in the chat. If you have time, just a couple minutes, please take our survey. We really appreciate the feedback and hope that we were able to put you in a good space to head on out to the holidays. Thank you so much, Genevieve, for that breathing exercise. It was very useful for me today.
Thank you, guys, and thank you for showing up. It's really, we have to take care of ourselves to be able to take care of everyone else. And we're so excited about this topic and happy to support you.